Tell us about how medicine is becoming more specialized, because it really is.
Yeah, it definitely is. No, nowadays, actually, the reason why it's becoming more specialized is because there's such an advancement within medicine itself. We have better technology, we have better procedure skills, we have more history of what went wrong back in the day. Let's take it forward and progress on this, from this mistake that we made. So things are becoming more outpatient-based, meaning like now we have urgent cares where we didn't have before. We have outpatient surgical centers, which we didn't have before. We have primary care offices, which have more with more capabilities to do more studies like x-rays, ultrasounds within the primary care offices, which was not present back in the day. So things are becoming more outpatient.
And this is really benefiting the patient as a whole, isn't it?
Yes, it's a great point, because think about it this way. You get more information at an outpatient setting on the spot.
And what about the internet? I mean, it's just fantastic how that technology is also moving mountains for people with that direct contact with doctors as well.
That's a great point. Yeah, one of the nice things that we have within our health system at Baptist is that we have the Pineap. The Pineap, you can actually, you download the app, which I highly recommend, because I think you'll get a lot of good, useful information of which emergencies are open, which urgent cares are open, and you can actually even talk to a physician on care on demand within our Pineap in 2 seconds if you need to.
How has the ER evolved over the years as well? Because it's just manifested itself tremendously.
That's a great question. Actually, I've been working in the emergency room for 20 years, and actually I've seen it evolve. In reference to back in the day where we would look at x-rays, with the images. Nowadays, we actually have the images right in front of us by a computerized system. And one of the nice things also, an example, if I need to speak to a specialist, I can give him a call. He from home or from his office can look at those same images that I'm looking at and guide me with what would be the best care for that patient.
I think also one final thought that I'm thinking of is just how much the patient has evolved too over the years. We're much more informed, we're much more educated, and I think that speaks volumes for what hospitals are doing and even social media to inform us.
Yes, I think you make a great point on that. I think that, at the end of the day, we as people got to take health within our own hands. We got to educate ourselves, because if you have an example like cancer or you have COPD or whatever type of condition, you should always educate yourself, because the more you educate yourself, the better you will be, because you will know the signs and symptoms. I'm like, I got to go to the doctor and get care.